Hiya, Nigel. Just have a seat on here for me.
Hey, cheers.
My name's Jo. I'm one of the nurse practitioners. So, what's been happening to you today?
Well, I was washing pots. A glass has blew out my water and it's still stuck in.
Oh, is it? A man washing up? Wow.
I know. First time for everything, isn't it?
Yeah, there is. I'll just take that piece of paper for you. Thank you. And what job do you do?
Gardener. Safer doing gardens than it is.
Then washing up. Whoever knew that was going to be. Do you want to just take that tea towel off slowly? We've got some gauze.
It's stuck to it.
Stuck to your glass?
Yeah.
Oh, yeah. Oh, wow. Well, normally we have an x-ray to make sure it's in there. Well, I can see it's in there. What I can do is a little injection to numb it, do it. Or I can give you something that you breathe in that'll make you feel more relaxed.
I'll have an injection.
You'd rather have an injection?
Yeah, just in a minute.
Okay, because you're a man, and in my experience, men faint a lot. So I always lay you down so you're more comfortable.
Yeah.
And also, if you start to feel unwell because of what we're going to do, then I don't have to pick you up off the floor. It's better to have them laying down, and then if they do start to feel unwell in any way, I know they're already lying down because a lot of them are too big anyway for me to pick up and get onto a couch. So have a seat onto here for me.
I can't really remember many women fainting.
Unfortunately, men do faint more than women.
Yeah, sexist as it is, it's men. Oops.
It's a man thing, and it's something that they can't control, really. So we'll give them a bit of sympathy. I think it'll come out quite easy, actually.
I hope so.
It'll get you out of washing up for a week anyway, that's...
Yeah.
Just want you to just rest your hand on here. Think of something nice. A nice holiday somewhere or something nice. This is the worst bit, okay? So just a little sharp scratch. Oh, sting, bee sting. Then it'll start to numb it. You're being very brave. I'm hoping it comes out in one piece.
I am.
Right, is that numbing a bit, do you think?
Yeah, because I can't feel it when you...
You're not feeling that?
No.
Think of Salou. Think of something nice. Voila!
Yeah. Oh, well, then. That wasn't as bad as I thought.
No. Removing a piece of glass from somebody's wound, and it's like finding treasure or finding a piece of gold, isn't it, when you actually get it out, and the patient's so pleased and, you know, appreciative of what you've done to get that out. But as a practitioner, a clinician, it's so rewarding as well. Right, put that like that. That's it. You don't want this piece of glass, do you?
No.
As a souvenir?
No, not at all.
Nigel heads to X-ray to make sure all the washing up has been removed.
Hi, all right. Hi, sir. I'm Drew. I'm one of the doctors.
Yeah.
Did you hit your head?
No, I just felt straight, flat down.
Give your toes a wiggle.
I can't.
That's painful when you do it. Okay. Right.
Paramedic Paul takes Gareth to Bay 2.
Although Gareth's not saying a lot and he's not complaining about anything, I can see that he's in pain. Because at the end of the day, we're all hard from Barnsley, so we've got to try and hide that pain somewhere.
Just need to work out which bits to X-ray of your ankle, okay? I'm just going to very gently press it.
Yeah.
If the pain's severe, just let me know and we'll stop. All right.
We become immune to shouts of pain or screams. It just gets drowned out by what you're focused on. It doesn't mean that you don't care.
All right.
Yeah.
I'm not going to prod there.
Yeah, that's fine.
Swollen. Okay. We'll pop a little needle in your hand so we can give you some pain relief.
Yeah.
Wait around for X-ray.
Yeah.
Okay.
Yeah.
Dr. Greer has Gareth's X-ray results.
So Gareth's fractured his ankle, so we're going to need to pop it in plaster to make him more comfortable, and we'll get him seen by the orthopaedic team. We're probably going to want to do a CT scan. So I think your suspicions are right. You have broken it. We'll chat to the orthopaedic team. Before we do that, though, we'll put it in a nice plaster, just because it's a bit of a support. It'll make it more comfortable for you.
They need to act now if Gareth is to avoid surgery. And that means plastering and resetting his leg. Despite the doctor's best efforts, Gareth wasn't as fortunate and needed reconstructive surgery. He had 2 operations and spent 9 days in hospital. He's now recovering at home.
Hey, new well. She never raised very paws.
He's in a lot of pain after falling at a friend's house.
How are we doing? Good man. So normally, if you break your hip, normally it comes up and it goes out.
I know it's really painful.
Do you have you had anything for your pain?
Well,
You've had some paracetamol for your pain.
Yeah.
So do you think you'll be okay until after your X-ray?
I might manage.
Well, maybe not. Should we have a smidge of something a bit stronger? It'll be akin to having a few whiskies. That's not a bad thing.
I don't drink.
Oh, okay then.
I don't drink, I don't smoke. No bad habits.
I haven't got any bad habits either.
I lost my wife.
Oh, bless you.
Then 10 months later,
Yeah.
I lost my youngest son.
Oh no. How did all of this happen?
Well, she'd been this ill for bloody donkeys, didn't she? She had chest problems, breast cancer.
Oh, bless her. You've been through the mill, you, my love, haven't you?
Well, I got through it.
That's the thing, we do, don't we? But it doesn't mean that it didn't hurt when you were getting through it.
It bloody did hurt.
The most important part of my job is to be able to make somebody feel like I'm listening to them.
Now, how long ago was that?
Well, it's 8 years.
I am sorry, that's such an awful time for you.
It was.
It's 2 minutes or 3 minutes out of my day, but actually it's a huge thing to somebody like Horace for me to stand there and have a chat with him and let him just let out of his heart what's up with him.
Why would they step on my nose?
You've got, that's perfect. So there's a little bendy bit here, right? And I'm going to put the bendy bit there. Now it might stay on your nose.
I don't have a big nose, is that why it stuff?
I don't think you've got a big nose, you've got a distinguished nose.
She's a good liar, isn't she?
Distinguished. I'm going to request your X-ray,
Yeah.
and then we'll get you round for an X-ray and we'll know if you've damaged this hip, okay?
Nurse Jasmine takes Horace to X-ray to discover if he's broken any bones. She's the first to see his results.
Can't look at ECGs, can't look at X-rays. It's just white lines and clouds with the chance of a little bit of rain later on. I'll get doctors to have a look at it and then we'll let you know if you can have a cup of tea. All right. You know when you go and bring a cup of tea to an elderly person and you just made their entire day just from a cup of tea, because tea makes everything better, doesn't it? Especially when you're in Yorkshire. Ta-da! Pop it on.
The latest ambulance arrival is 18-year-old Lewis, who came off his moped at high speed.
The main concern with Lewis is his right arm. We control the bleeding with the dressing, but doesn't wait to irrigate the wounds because they're very, very painful. Oh, you get a bit more, we'll take it off you. I love to sit here all night and talk about scooters, but, you know, 42. Come on, Lewis, all the best, mate. Cheers, man. See you later.
Nurse Millie wants to take his obs.
Yeah, as long as it's not on no needles.
Well, we've got this on your arm. Where's the majority of your pain then?
This arm. Hello. I'm just in hospital. Oh, I'm going because I put a needle in there. Can I have some gas in there? I don't like needles.
Alright, go off the phone then.
I have to go, Mum, I have to go. Right. I don't like needles.
Just try and just look other way.
Oh, man. You can't give me a needle. I don't like them. I need some gas in there somewhere.
Louis.
No chance, man. It hurts.
I'm not going to do it.
Oh. No, you're not putting no needle in me, no.
I'm taking it off. I'm taking it off.
It hurts like cold, man.
It's not a needle I want to put in your Lewis, it's a little plastic tube.
No, I don't want no.
But we need to get you sorted out.
I'm bothered about myself.
Lewis's needle phobia is going to test the bedside charm of junior doctor Tom Fish.
Hi Lewis, I'm Tom, one of the doctors.
Not putting on needle in me, and
That's alright, that's alright.
take them away.
Lewis, can I have a chat with you? Is that alright?
What's on there?
My name's Tom, one of the doctors. I can see you're in some pain.
Right,
Have the paramedics given you any pain relief?
well, yeah, only paracetamol. I've infused morphine, but I don't like injection. I don't like needle.
That's absolutely fine. We can give you some tablets. All right. You can try good cop, you can try bad cop, and often neither work. Lewis, mate, because obviously you've come off at a reasonably good speed, I need to kind of check you out top to toe.
I don't think you have to put a needle in me, check me out.
It doesn't?
Yeah, go on, mate.
Is that all right?
Yeah.
All right.
Still want no needles at all.
I know, I understand that you don't want any needles. I think for the majority of my adult life, I've been a very positive person, and even before that as well. I think it's just something that was instilled in me by my parents. It's almost as bad as my bandaging, yes. Yeah, so I wouldn't be surprised if there's a bit of you breaking that. All right, do you want to rest it down where it's comfortable for you? Because the support is going to be a thing for it at the moment. So they're going to need to get an X-ray of that.
Yeah.
In terms of temporary bandage, just get something reasonably tight around it. We could give them a sling as well to get to X-ray. Good job you're wearing a helmet.
Don't have some gas in there?
So if they're going to need to move it, we'll get you some liquid morphine, some no needles. Is that okay?
Yeah, mate, yes.
People can make their own decisions. I can't force people to accept anything if they're of sound mind, and I wouldn't want to.
The nurse has returned to clean up the wound.
Hey.
Oh! Ah! Oh! Ah!
Dr. Fish suspects Lewis has a badly broken arm, which could mean an operation, an anaesthetic, and needles. Terence suffered bladder problems and became confused, so his son Paul is allowed to be with him.
Is this Terence? Excellent. I'm Emma. I'm one of the doctors. Can you tell me what's been happening today?
I can do about 4 o'clock.
Mm-hmm.
And the right is our through.
Oh.
I'm not using like that.
When you say wet through, do you mean that you were sweaty or that you'd lost control of your bladder? Okay. Sorry, I'm going to have to move closer. My hearing isn't amazing sometimes.
Seem to a bit unusual.
Okay, don't worry. Has it happened before?
Not really.
Not really. And have you been for a wee since?
Yes.
And was that completely normal? Normal. And you could you tell when your bladder was full?
Yes, but I have a weak bladder.
Okay. No trampolining then? All right. May I have a feel of your tummy? Is that all right? We lie you down a bit. So will we listen? No, that's absolutely fine. So I think that's all okay. It sounds like you've had a single episode of urine incontinence that's now gone away. So I think what we need to do is check your blood test if we sent some bloods. It looked like we'd stolen some from you.
Yeah.
Now I'm going to check all those results before we say you can go, all right? Don't go running off in the meantime. You can get up now again if you want, actually. Shall I sit? Ooh. That was a little bit more violent than I was expecting that to come up. Open or closed?
I'm not worried.
See the world, goodbye.
Yeah, that's it.
Dr. Farraher hopes this will be a simple case and Terence will be able to go home once she's seen his bloods.
I don't really know why.
Terence's blood results are alarming, so the chances of him being discharged are now in doubt.
So, 1, your infection markers are really high, and 2, your oxygen's a bit low, in which case I'm going to give you some oxygen. Put those in there, around the ears. There we go. Your white cell count's nearly 22.
Yeah.
Normal's less than about 9. So I could have coped if you'd had it sort of 11 or 12. I can write that one off for some inflammation somewhere, but this is quite a big response. You need to come into hospital while we play Hunt the Infection.
Sorry about that. One other thing we probably need to do is pop in a cannula. Right, can I have a look at this left arm? Am I right to use this one? Sharp scratch.
I'll do it, so what's buddy?
No, I'm afraid not. Right, this is going to be cold. This is just some salt water. How's that?
All right.
Excellent. Right then, there you go.
Terence was kept overnight and after a course of antibiotics for a chest infection is now on the mend.
I've been trying to chat him up.
It's just a shame we have to wear all these masks. She's missing out on how handsome I am. Right, Val?
You ready?
Thing like that.
Way! Oh, I am satisfied like that for ages.
Val has been off colour for 3 days, but has just taken a turn for the worse.
Daughter's come round today and found her in the bedroom, sat in the chair. New onset of confusion, shortness of breath, very unwell. Goes to call an ambulance. Right, Valerie? They'll look after you from here, all right?
Well, thank you very much.
Very welcome. You take care, lass.
I will do.
See you.
You can take me out one day.
Auxiliary Wendy arrives to insert a cannula.
Cheers, darling.
Valerie, are you okay to take some blood from you?
Yeah, definitely. I'll just call you Dracula, yeah?
Right, you do. Sharp scratch coming up. You're doing really well there.
I'm a lover. Yeah. It's red hot in here, isn't it?
It is warm, yeah, definitely. All done and dusted. Look at
Oh, don't look at that.
Perfect.
Oh.
Val is given some medication to help open up her airways.
So, we've got some steroids for you.
Okay.
Yeah.
I hope I'm not going to grow a beard.
Hopefully not.
Oh, I've been shocking.
Have you?
Yeah, it's been absolutely murder.
Right, so we need to take this mask down.
Okay.
Obviously.
Oh.
And then this one just goes round the back of your head.
All right,
I'll
sweetheart.
just tighten it up a little bit for you.
Yeah,
Is that all right?
that's lovely.
Yeah. There we are.
That's lovely, thank you. Oh, I'm in some trouble, aren't I?
You feel all right?
Well, I've just had a heart attack. Well, I've had another bloody heart attack the time I get this out of the way.
It's been warm as well, hasn't it, which probably doesn't help.
Sorry, Bob. Very frightening.
The heat wave is aggravating Val's breathing difficulties, and it's also affecting the staff. Dr. Sarah Brown will be looking after her today.
Right then, so how's that chest feeling since we put this on?
I'm very tired. I'm drained. But I feel better than what I did when I came in. I thought, oh, I've never known an experience like this.
Has it just been your breathing that's been a bother?
Yes,
Yeah. Other
Yes.
than that, you've been all right till we've
I'm not been so bad now, but I've been a bit frightened because I've had a heart attack. And I was thinking, I hope I'm not going to have another.
You let us worry about that bit. Have you had any pain in your chest at all?
In your stomach.
In your tummy? All right, let me have a feel then.
Yes.
It's a little bit, still a bit sore, isn't it? Yeah, you look like you're fidgeting a bit.
Yeah. And this weather hasn't been out.
Yeah, it makes you feel really hot, doesn't it?
It's very warm in here.
It is, you're right, I know.
I've got a right dab on.
Sorry.
A dab. Sweating. Barnsley talk.
I'll open that curtain again in a second. Hopefully that should make it a little bit of airflow in here for you.
Thank you for being nice.
You're very welcome. All right.
Okay, sweetheart. Bye-bye.
Val is going to have to hang on in the casualty heat until her blood results come through.